Hello, everyone. Welcome to another episode of the Healthcare Inspired Podcast. We are here with our season on the Connected Leader. I have my amazing co-host, Maya Turner. Welcome back, Maya. How are you today?
Hello. I'm wonderful.
So
I'm
excited to
wonderful.
see
It's
you
good
on
to
the
be here.
show. I'm just so grateful to be with you as always. And we're going to have a great show, I think. And I think that our audience is going to really like today's episode on conflicts. Now, oh my
Yeah.
goodness. I know we've both been in healthcare a long time, at least 20 years for the both of us. I know you've been in healthcare a little longer than me, but we've all seen the challenges and maybe we've had conflicts in life, in relationships that we realize, okay, these conflicts are unavoidable. We're so close to these people every day that it's inevitable. We're going to have conflict. We're going to have situations where we're not going to agree all the time. We're going to have situations where we're going to feel like, okay, I don't really get you and I don't agree with you, but let's
Mhm.
agree to disagree, right?
Yeah.
So,
Yeah. No, I think part of change, there's always going to be misunderstanding. And we have to convert misunderstanding to communication rather
yes.
than conflict. Because we always have a learning curve because technology is always changing. And because technology is always changing, we have to evolve with it. And some people
Yeah.
are going to be rolling with the change, and some of them are not going to roll with the change. So you have conflict or you have resolution. So,
Absolutely. Yeah. And there's a difference in the way we communicate. So, again, going back to the amazing publication that our organization is putting out, I am so grateful that I have the opportunity to have a platform where I can share the work that I have put together this year. I am just so proud of the book that's being released later this year or next month. Actually, the year's gotten away from me. It's already almost September, and
I know.
my communication drops next month, and that's what we talk about is those different communication styles and how it contributes to either conflict or conflict resolution. So we want to talk about conflict resolution, but also prevention, because I think that there's a way that we can learn how people communicate as a leader and realize what our responsibility is as a leader to understand the way our different staff members might communicate, and in the different roles they're in, they might not really understand what they're supposed to do. So maybe they're just not communicating because of the way that they communicate. So, as an example, I know we talked about this before, but there is a lot to be said about the way we're raised. The culture we grew up in has a lot to do with how we communicate later in life. Would you agree?
I absolutely agree. And it's evident how different, I'm trying to stay on path, especially when you go to the grocery store, right? When you go to the grocery store and you see the kids running all over the place, and then you wonder um, how their lifestyle at home is. And there's a saying, you know, raise your kids to be respectful now, or someone else will teach them to be respectful later.
Oh, it's
And
true.
so it's very true. And I think in this day and age, because we're at a cultural swing, communication and valued opinions are not really the emphasis on our culture. And therefore you have conflict. If you don't agree, then that's a conflict in someone else's eyes. But you cannot agree and still communicate in a great way. So I think that's important.
Absolutely. I totally agree. And I was just thinking of an example. This is okay. I'm going to preface this by saying there are some that are raised even now, or even several years ago, where they weren't taught the responsibility that they're going to have in life later on. And everything's done
Accountability.
for them. Everything's done for them. So this is just a weird example, but my friend worked at the library. Okay. And they had this program where the high school students would come in and they would kind of learn the ropes or whatever, but part of what they had to do was keep the library clean. Okay. And so this one young lady, she was asked to get a duster and dust the shelves. And she looked at my friend like, what are you talking about? You want me to take this and just dust? Like, she did not come there for that. what do you think you're here for? You're here to serve regardless. I'm sorry you have a maid at home who does everything for you, but if you want
Wow.
to here, you're going to work. So I
Wow.
don't mean to step on some cultures and the way things are done, but in a role like that, if you're going to step into a role that serves others, you have to know what that means. So
Well, yeah.
I just have a
I
problem with people that don't want to do the work. Now, if you want to have a life where you everything's handed to you, those lives exist out there, and
yeah.
many people live just fine like that. But if you're going to
Yeah.
step into a role where you want to serve others, and you're going to have to serve others as a leader, or if you want to move up the ladder, the higher up you
Mhm.
move, the more responsibility you have, and the more people you serve.
Mhm. Mhm.
They don't
Mhm.
serve you; you serve them.
And it's so ironic that the accountability as generations get younger shifts, right? The
Mm-hmm.
accountability shifts. And I always and have always said this, a person who is a great leader has a great mind for customer service and being of
Absolutely.
service. And because of that, and because of how that shifts, even in the classroom as a teacher, you get students who don't understand what accountability. You want me to do my homework at home? I have to play the game. You're like, what? What?
Oh my
You know,
goodness.
it's like, how do you even
How do you
comprehend?
life? How do you life? I'm telling you what, I don't know.
I wasn't ready for that.
Oh my gosh. Oh, I tell you what.
Yeah, how is life for you? Like, really, how do you life every day? Mm,
I don't know. Well, it is what
mm,
it is. And so there's things like the hierarchy of structure in business where you have somebody over you. Even a leader who has multiple people under them has somebody over them. And maybe
exactly.
even like the owner of a company still has accountability above them. There's the government and there's the things you have to do to be a business owner. You're never completely like in charge. Just saying.
Right. And that's
Somebody's always
always
higher than you.
exactly. And they're all, and in my opinion, in every business, not only is there a need to be of service, but there's also the need to be accountable.
Hmm.
Even if you're not the person who did it, if you are the leader, you have to be accountable. And I always say, the accountability is the measure of a person. It always is. Whether it be a physician, their accountability is the documentation. Whether you're a coder, the accountability of it being correct or incorrect. Did you fail to look up the NCCI? So there has to be a careful balance of understanding how to deal with leadership and how to deal with conflict. And that
Hmm.
all is a dotted line. And if we fail to see that dotted line, then we're failing as a leader.
Absolutely. And I think I wanted to kind of go back to this thought process in my head because I tried to remember what it was like for me growing into my career when I first started, and I had different types of managers or supervisors over the years, and I
Ooh,
tried to figure out, okay, which ones did it this way and then which ones did
yeah,
it this way. And what I observed as I was meditating or thinking about, what I had gone through in my career, the ones that had kept their cool in stressful situations and who there's pressure regardless. If you go into this role, it's pressure regardless. Even in healthcare, no matter what you're doing, it's always high stakes. It's always pressure, stressful situations. But it's how you respond to them that makes you a good leader. And so the ones that kept their cool and didn't panic are the ones I look to for guidance. I look
yeah,
to for support. Back
yes.
in the Joplin tornado. So I was working in the hospital then, not the hospital that got destroyed, but our hospital was across the street. And I put this in the book too. I talk about this example on leadership and communication during a tragedy or a disaster. And so one of the things I really appreciate about my supervisor, she didn't panic. She knew exactly what to do. Because yes, we all took those in services in the hospital that told us exactly what to do during disaster. But in the real world, like, you
Yeah.
don't really do things like that because you think you're going to, but there's always those people that panic.
Yeah.
Have all of these things laid out. In this situation, you're supposed to do it this way, but
Yeah.
we
Yeah. Yeah.
never really do it that way. It's stressful. Like, we're like,
Right.
we don't remember what we talked about, what's the best way to do
Mhm,
it.
mhm.
But she was so great and so much of a leader. I'm going to shout out to Barbara Joe, because she was the most amazing manager I ever had. And to this day, I appreciate what she taught me. Now, yes, she was tough when she needed to be, but she was also compassionate. And she also knew how to get things done in a very efficient manner, and she didn't panic. She knew what needed to happen. And so if someone had a conflict in the office, she knew what she had to do to take care of it, but she didn't panic, and she didn't make us feel like we couldn't come to see her. But at the same time, she had boundaries, and we knew that. So I just love so much of the things I learned from her as a leader. And so if you have that experience with someone that you can just really look at to as an example, please use that. And please look at others like that you can find in your career that as an example of good leadership. Even if you don't have that, that is what true leadership is. I'm telling you, 100%. There are people out there that do lead that way. And those are the ones that we want to see more of
Right.
in the industry, because we need you to keep a steady hand and be calm when things are going crazy, so that we can make good decisions. You can't make good decisions when you're stressed out and you're not thinking clearly.
Absolutely. Absolutely.
So
And yeah, I
that's
think
my
also, no, I mean, and that's very true, because if the leader is just as stressed and has high anxiety in the situation, how are they going to lead and how are they going to guide the team?
mm-hmm.
So you think about that. You think about the person who's laid back. Their mind is rationale. Their mind is not panic. Their mind is not on anxiety. So you, in turn, feel a sense of warmth and relief when you're
Mm-hmm.
able to go to that person and know that they're going to lead them in the right direction. And
Yes.
those same types of leaders are very motivational,
Mm-hmm.
and they also uh, catapult are a champion for change. But the change is not for the org; the change is for you to be the person that you're seeing in them. And both of us as managers and have had that experience. People have always come to us and said, we need da 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 da, and they always resolve with a thank you. They
Yes.
always resolve with, I really appreciate that. And if you
Mm-hmm.
don't hear that a lot as a leader, then something is wrong. And
Mm-hmm.
you need to really think about your approach and how people are receptive to your response. When they say thank you, that means that they appreciate that.
Absolutely. And the manager I had not too long after that, same thing, Laura Vineyard. I love her to this day, and I still talk to her and share things in my life with her, because she was one of those leaders that really cared about her team and made sure everyone was okay all the time, and made sure
Mm-hmm.
we needed to do our jobs, always made sure we had resources. I mean, like, thankfully I know some out there don't have this, and I feel bad for you, but I really do appreciate it. I'm so appreciative of the roles I've had, because I hear horror stories out there, and I just am so grateful that I didn't have that. But I am very compassionate, and I feel empathy for those that don't have that kind of leadership, where you don't have what you need to do your job, and you don't have people that are in your corner. They're all looking out for themselves, and that's really sad. So if
Yeah.
you're in that situation, I promise you it gets better. And if it doesn't, then maybe you realize there are other options for you. And there's
Mm-hmm.
plenty of work out there. I was always taught to think 10 steps ahead. And I have a colleague that taught me that in the last couple years, because he did the same thing. You always think 10 steps ahead. So if you're ready to leave a role, you don't just leave. You plan it out. You make
Yeah.
sure you have an exit plan for when it's time.
Yeah.
Get your feelers out there. Start thinking about it if you need to. But
Mm-hmm.
if that
Mm-hmm.
comes to that. But what I want to focus on is leaders, don't let your team get to that point where they want to get out of there. Like,
Yeah.
don't
Yeah.
let them
Real leaders
feel that.
inspire.
Yeah, I mean, we need people in healthcare to do the work and to be compassionate and to be passionate about what we do in healthcare. And if we're not helping them do that, then we're not in the right role. We shouldn't even be leaders or managers, because a manager
We're
is
not
one
connected.
thing.
Yeah.
We're not connecting to our teams. We're not helping them be successful. And so one of the things we want to talk about next is our conflict resolution. So sometimes, yes, you have conflicts, not only with different parties, like maybe your hospital and an insurance company, or internally staff members, or staff to manager, or manager to manager. I mean, there's all kinds of conflicts that exist, but there's a lot of different skills that we don't seem to be honing in on these days that we need to have. We're all created with these abilities. We know how to listen. We have ears that work, hopefully. If we have good hearing, we can still hear the words, but hearing is not the same as, or listening is not the same as hearing. So you can hear things all day long. It doesn't mean you're actually listening. So we talk about active listening, right?
Mm-hmm.
So active in the way that you understand what they're saying and also what your response is going to be, but you don't just say it, you think about it. Okay, here
Right.
is what they're telling me. This means I have to probably think about these things, but before I do that, I need to consider all the facts, and that's active listening. So making sure that everyone understands what is happening and then following through with it, that shows you're actually listening.
Right.
um, so what your team is going to have to communicate with you, are you allowing open communication? First of all, are you
Right.
allowing them to say, and I love this point that I found, using I statements to express concerns without assigning blame.
Mm-hmm.
I really love that. Because that makes them feel like you feel for them, you understand, I understand what you're going through, or I
Yeah.
get what you're saying.
Right.
And it's not like, and you're not putting it on them like, oh, you should have done that, you should have done this, why didn't you do that? Never put you in there.
Or
Always say
compare.
I.
Or compare. Right.
Yeah, compare.
Compare.
Yeah.
Yeah. Yeah. Yeah. And I think also when we put ourselves in the position, it creates a platform of empathy, right?
Mhm.
And the empathy with the employee versus the manager, it becomes the walls are not manager employee. The walls are mutual conversation. Let's
Mhm.
understand, and then it puts a open line of communication or questions. What can I do to do better? Here's what I suggest. Or since you've asked that question, let's do that. So there has to be a method. There has to be a situation, and there has to be communication. Once that communication occurs, then the next is, how do we resolve it? Here's some
Mhm.
ideas. Here's is what I suggest. And then you see the motivation or the transformation occur between the manager and employee, because then they are motivated to change. So
Absolutely. And one of the most
yeah.
successful things that I've seen is collaborative problem solving. And it's one that keeps popping up whenever I research problem solving. It's the collaborative approach. Because what it means is you're allowing your team members to voice their solution to a problem.
Absolutely.
So,
Democracy.
yeah, it's right. And so you have a problem. These are the issues that exist. Our AR is over here. We have denials piling up over here. We have a list of prior authorization denials. Why is this happening? So now you have the opportunity to say, here's the problems, propose a solution.
Mm-hmm, mm-hmm,
And
mm-hmm.
that way you have different minds that don't think alike. They're all different. They come from different backgrounds, different communication styles, different ways of viewing the world. And now they've come together and they are voicing their way of doing things. And then as a manager or a leader, your responsibility is to take everybody's voice into consideration. And you know all the facts. You have a bigger picture, right? And that's the true for staff to realize is sometimes you don't know all the facts. So don't jump to conclusions that your
Right.
leader or your manager doesn't know what they're doing. They are thinking of things from a broad space, and they have things that outside of your scope that you don't know yet. So
Yeah.
don't jump to say, oh, they don't know what they're doing, they shouldn't do it this way. You don't have all
Yeah.
the facts. So
Right.
wait, for that guidance. And as a supervisor, a manager, leader, director, make sure you are giving them that guidance and giving them the pieces as they need to see them. Don't hold
Yeah.
back.
Yeah.
You need to be transparent. But yes, there are times where you don't need to know information right then because
Yeah.
it's part of a bigger picture that hasn't been
Right.
resolved yet.
Yeah.
But
Yeah.
you still need to educate your team and give them resources. That's not what I'm talking about. I'm talking about bigger picture things that are higher level that they don't get the right to know right now.
Yeah.
But
Yeah.
you still want to give them the opportunity to share their thoughts, their views and ideas, because you never know when that idea is going to be the light bulb that your organization needs.
Absolutely. I can recall, like, sometimes you have to, and sometimes managers and leaders have to be intuitive. They have to see beyond what's in front of them. So one of the things that I think is really, really important is when something is put before the team and say, I have something in mind. I want to do this. I want to do that. I need for you guys to da 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 da. Well, why we got to do that? But then once the idea comes and then you realize the end result, well, because we did this, now we don't have to cut people. Because we did
Right.
this, now we can order blah, 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 blah. So it's all about setting the tone, but giving them just enough to act and then showing how they are progressing and then show the resolve of what that idea was about. So, when you're dealing with those types of things, it's not just about the manager telling you what to do. It's about the bigger picture that nobody is able to see, but it's still to your benefit. But you have
Mhm.
to trust the leader to give them the benefit. You have to trust them. So definitely
Absolutely.
understood that. Yeah.
Absolutely. I agree 100%. And I do think that we are at an age now where things are changing. Of course, technology is changing, the way we use technology. We have to accept that we don't have to use paper as much as we used to. So some might still be resistant to change. And as a leader, you need to be able to make sure your team knows we're not trying to change you. We're not trying to change who you are by telling you to do something else. I think some people take it so personal when we tell them to change a process that they've been doing for years. Like, it's not personal, it's
Yeah.
efficiency. And
Yeah.
it's, if there's a better way to do things, why wouldn't you do it?
Yeah.
So I think there's a way to talk about that in a way that's not demeaning to a person, but help them see, like, this is the turnaround time. We could improve this process if we do that. For instance, not many might realize that you don't actually have to send paper to Medicare anymore. Did you know
Nope.
that?
Mm-mm.
Did you know you can actually do e-signatures now with
Mm.
Medicare, especially with when you're trying to send the PCOS forms, the 855A, or whatever form you're using? Like, you can do e-signatures to the authorized official, and they can just like click a button and they can be done. Recently, we were doing a project for credentialing, and we got Medicare approved for a brand new provider, brand new to anything. Got her approved in less than a week.
Wow.
Not even kidding. And it's like
That's
there was
impressive.
pushback. There's pushback because, oh, we have to do paper. We have to have a wet signature. I'm like,
No.
it's 2024. I guarantee you. It's like, call the MAC. They will tell you the same thing. I promise you, it's
Yeah.
different now.
Man, what
So
was
you
the old
gotta.
turnaround time? 3 months, right? It was 30
Oh
days.
yeah,
It was easily 3 months. And that's if
yeah,
they didn't, that's if they had everything.
yeah. So if someone tells you, hey, there's a better way to do this, I promise you, it's faster, more efficient. We're gonna get things done quicker. And isn't that what you want? The money to come in faster?
Yeah.
Isn't that what
Yeah.
you want? Isn't that the goal? So
Yeah.
don't get stuck in the way you've always done things. If it's going to slow the process down, be willing to be humble and realize someone's got a better way of doing it. And that's the
Right.
fact. That's the
Yeah.
fact, right?
Yeah. Absolutely.
There's nothing we can change about it. So, okay, now let's think long term. There is long term prevention now that I wanted to highlight, because yes, we want to talk about resolution, but we want to try. Prevention is always better than having to resolve something. It's always better to prevent and think about changing a culture, because sometimes a band aid is not going to do it. Sometimes the cut is deeper. And if you don't clean the wound, it's going to get infected and it's going to be a systemic issue. So yes, I
Great
look
analogy.
at everything in life from a healthcare standpoint. It's funny. I always end up using wounds and ortho terminology in the way I do illustrations. I always end up going there because of what I do. But it makes sense, right? The deeper that injury goes, the more dangerous it becomes to the organization. So you want to make sure clean it out, prevent it from happening, right? So
Absolutely.
again, a culture of open communication. Communication is the key, and that's why I wrote a book on it, guys, because it is something this industry and most industries need these days. So the book on communication, Clear and Connected: How Effective Communication Builds Trust in Healthcare, drops pre-order August 30th, and of course you'll be able to get a printed copy not too long after that. So I really encourage everyone to wait for that publication to drop, and we're going to have a go live introduction to the book on August 30th, and we're going to dig into that. But you need to figure out now how you're going to build your culture of open communication. You need regular feedback, and guess what? That's part of your compliance
Yeah,
program.
yeah, yeah, yeah,
It's one of the
yeah,
elements. It really is. So
yeah.
think about that. And I really do encourage you to attend our upcoming Inspired Compliance Seminar on December 7th. We have some great speakers, and we're going to be dissecting each element of the compliance plan. As a leader, this will also help you with your communication with your team. It'll help you understand why you have to communicate these things. It's not just about the rigorous policies. That's not what compliance is all about. It's about a culture of understanding what's right and wrong. And that's what you're going to learn. You're going to
Yeah,
learn how to show your team how to do compliance right and why we do it. It's not
yeah,
just policies and laws and regulations. That's a
no,
part of it, but that's not all it is. It's how we communicate, it's how we resolve conflict, it's all of those things. So it's a really good event for you to take your team to, have your physicians come. It's all virtual. There's going to be 7 or 8 CEUs attached to that for those of you who have a credential in compliance or coding or whatever. So think about that. And again, what I love about communication styles that we learn that are just different. How many have you ever done a team building exercise, Maya?
I have, I have. It was quite funny. Well, everybody knows that I'm a little transparent, sometimes too transparent for others. But we did a team building exercise, and we had to put ourselves in the role. One person had to be a patient, another person had to be the physician. I was, of course, the physician, and his name was Dr. Amadik. So say that real slow. It
Nice.
was so funny. So we had to put ourselves in a position of understanding and communication and see how uh, it means for a physician and a patient to have a conversation, and then see how that all translates to paper. And so
Mm-hmm.
a lot of times we think the physician is all about barking, but it really is about the patient's well-being.
Mm-hmm.
So being in compliance and being in coders is all about the physician's well-being. So you kind of have to understand all of those dynamics, and it really, really, really worked well, because we were a part of a program, and I forget the name of it specifically, but it really assisted. Oh gosh, what is it called? I can't think of it, but it was a big, big program. Conversation, something conversations. I can't remember what it was.
Okay.
And anyway, it was, we did that, and it was really helpful. And it took us to it took us to see those dynamics to make a difference on how we communicate with the physician and how we put ourselves in the mind of the patient as well as the physician.
Right. And other organizations might have team huddles. They might do offsite activities. They might take them to what is that place called? Top Golf is a common place that
Oh,
I've seen people take them to. It's really fun, right? Because you get
yeah,
to work in a team environment and you get to hang out and just get to know each other on a different level. And it helps you appreciate the people even that you work with even more. So I think those are great opportunities for team strengthening. And then also, just as a final thought for all you leaders, is thinking about your example. Lead by example, and always show your team that you care about them and that you're not out for yourself. Because if you always think of yourself as serving others, you're always going to have people that want to follow your example. And if you are always that person, you're going to make sure the organization is of course, succeeding. And if you care about the organization's success, then they're going to care about it. And it's going to just trickle down. And the whole organization is going to be putting the welfare of everybody up here instead of
Mm-hmm.
their welfare up here.
Yeah.
So it's all about that. So I think it's just a really great thing to think about is example as a leader and just being that person people want to follow. So that's our topic today, but we're not going to leave you with only that. We actually wanted to give you our compliance tip for the week, and it's actually a coding tip as well, but we're really going to talk about, I guess it's more of a billing topic, but incident 2, because I wanted to tackle this question once again. We bring it up every once in a while, and it's been, of course, talked about more recently again. We still see lots of cases where people are abusing it, and I had an experience recently where it really hurt a practice that didn't understand its proper use. And so I just kind of wanted to talk about it. And then Maya's going to share some things that are updated recently they want to think about for the future on Incident 2. But just think about it, because in general, what you're asking the insurance company to do is pay you more money. And that's literally what you're asking, right? Because your mid-levels or your non-physician practitioners have an NPI number. And they can bill the insurance on their own and get paid, yes, somewhat less money than if they billed under the physician, but it's not that big of a difference in the long run in many cases. In some cases, it's not that big of a difference. So what you're doing is you're inviting risk to your organization whenever you decide to do Incident 2, where you're billing under the physician versus billing under the one who has their NPI. There is a proper way to do Incident 2 that's not going to harm your organization if you do it right, which means you definitely need to have a compliance plan. If you don't already, have a compliance officer who has this tight. The policies are tight. The what's the word? The adverse action for doing it wrong is going to be followed. The corrective action, you're going to understand what's going to happen to you if you violate this, and it's going to be followed through on. So the organization is kept clean. Now, Maya, what do we have going on recently that's going to remind us of what's important with this and what's the future look like for Incident 2?
Well, everybody knows that COVID changed quite a bit when it came to services related to Incident 2. And what's happening now is that there is a proposed rule for 2025 that states that they are going to allow or they were considering allowing Incident 2 for audio visual presence in addition to being physically in the suite. Mm-hmm. For Incident 2 services. Now, what does that mean? Now, when we talk about Incident 2, it's not just about the NP or the mid-level provider practicing under the physician, but it's also the physician's presence being allowed or being required for certain services that have been ordered by them. So when the mid-level providers works with the physician, they work as part of the ancillary staff and the physician gets 100%. But when the mid-level provider bills on their own, it's 85%. But when the physician takes on the bill and they're the billing and the servicing provider, then it's 100% reimbursement. The requirement for that is that the physician be present. Mm-hmm. During COVID said that the patient, the provider can be present via audio, video, telehealth, or whatever, right? But it's supposed to end on December 31st, 2024. But now the proposed rule states that they're proposing it to be permanent. That if a physician is available via audio visual, the proposed rule is that they are allowing this to be ongoing forever and ever and ever. Kind of like they did with the telehealth, like, well, this is only going to be, it was like everybody was like, oh, and then everything, next thing you know, it's permanent. So for those of you who have dealt with or continue to deal with issues with the provider being in the office, know that there is always
the number one issue with that is the physician there.
Right.
So
And if
true.
they have, but they have to prove that they were present. And if it's documented that they were present via audio, video, then it would still count. And as of right now, it still counts up to December 31st. But if the proposed rule becomes final, then it'll be forever. And that will be something that can be also considered when there is incident to billing. Now, how it's
Yes, and
documented that the position was present, yikes. But it still needs to happen. So there has to be something there to prove that.
yes, and one thing I will tell you from experience with certain payers, not going to name them, but there are some managed care organizations that have a specific policy that is sometimes overlooked because guess what? It's true. We sometimes don't read the policies, even though we're supposed to. So I know there's offices out there, I know there are, that don't actually read all the policies. Who has time, right? But if it's going to
Mm,
affect your risk to your organization, you better read it. There is some
yeah,
fine print as to those rules and what they need documented. So you
yeah,
also need to
yeah,
pay attention to that because sometimes they give you very clear instructions on what your documentation has to state in order for them to accept that concept
yeah,
and who can do it and who can't. And so that may still be the case even with this telehealth audio visual situation. You're still going to
yeah,
have certain documentation.
yeah,
Yes, they're going to be able to, the presence thing will be different than it has been in the past, but you're also going to have to pay attention to your payer if they even accept that type of billing. So that stuff's not going to change potentially unless they change their policy. But in
right.
general, you still have to pay attention to that. I just want to have you use caution, run a report and see how often you're utilizing it. What's the difference in pricing? Because guess what? If you do it wrong, you have lost all of that money in
Yeah,
an audit.
yeah.
And the legal fees for doing it wrong and for committing the fraud and all of this, like it's not worth it. Because all
Now,
that time you spent, like, oh my god, all this extra money is now out the window because you had to pay it back and you did it wrong.
for
So
15%, no less. So I
yeah.
think, from a compliance perspective and having been, around and we've seen like nightmares all day
Mm,
long, the thing is if your organization practices incident to and they put together this rule or you're currently using the audio visual rule, have some sort of documentation to show how the physician's presence was affected for that type of care and how and what they did to assist with that. Like
yes.
that's with the nursing visits as well. When you're doing a nurse visit, it's based upon an established plan of care, but the provider still has to provide some sort of input when there's a nursing visit when it's required. So have something documented to indicate that the physician was present via audio visual and what was advised or what, have some sort of attestation statement to indicate that they were present so that you're able to bill for those services that are incident to. Because the more an ounce of prevention is worth a pound of cure. The
Mhm.
more careful you are about what the services are and what's being performed, the better off you'll be and the less risk you will have.
Yes, and I think Maya recently talked about, because Maya and I are working on an EMR optimization project, and one of the things that we talk about is the build. The build of the EMR, how it took place, is a
Yes.
huge part of the puzzle. Now, I'm all about prevention, and one of the things your organization can do to prevent these things is to understand how to use your EMR effectively. So you can actually put things in place, stops and checks and balances that make your staff stop and think before they go any further. So if you're going to use Incident 2, I highly recommend you get with your IT team and get with EMR vendor if they need to help you with this, or you can call on Maya and I. We love EMR optimization products, and we can help you figure out how to use your system
Yeah.
to actually be beneficial to you. And it's what we do at
Right.
Healthcare Inspired. We do
Yeah.
EMR optimization. It's one of my favorite things to do is like, okay, you're doing everything right, but guess what? Your EMR is not helping you.
Yeah.
So we need to make sure that it's working for you. You're not working for it.
Right.
So
It needs to be a fluid process, and especially when your EMR is designed specifically for your practice. You shouldn't have to go for 10 steps and it really only takes 2 to get something done.
yeah, exactly.
So, I mean, optimization and time saving. I mean, that's probably one of the biggest drawbacks when a EMR optimization is not implemented for the organization. You spend a lot of time and a lot of effort when really it shouldn't take that much time to get something very simple done.
Exactly. And you want to set it up right the first time. Yeah, maybe down the road, a new policy comes up and it makes you have to change something in the system, which is a quick fix. But if you've already had it set up right the first time that works for you, it's just a quick, easy, kind of workaround. And then you haven't changed the EMR itself necessarily, but you just changed the process.
Yeah.
So think about all the things that we have to do now that we have to make sure that our system is actually helping us rather than hurting us.
Right.
So that's one of the things you can do to help with that system. You're going to continue doing incident two. If you just are like adamant and your CFO is adamant, we're going to keep doing this because it brings in more money. Sorry, Steve, you know that that's your job to make money.
Yeah.
So if you want to make it right and make it compliant, then this is what you got to do. So
Yeah,
keep
and
that in mind.
communicate, right? You have to communicate that there is a deficiency or if there's a need, and then you have to have a form of resolution to
Mm-hmm.
help. So if there's something that's not working, and you know that as an organization you need it to work, you have to communicate that, and then there has to be a resolution for that to work. So in order for it to be optimized for everyone's benefit, you have to communicate that there's a problem.
Absolutely. Well, guys, it's been great. It's been real. We've had a great conversation, and I am happy that we got to talk about conflict resolution, prevention, managing conflicts. It's really important to help building our teams and creating a culture of not only compliance but a culture of communication. So
Absolutely.
let's stay in a culture that is the culture where we're communicating and we're helping each other. Let's stop this toxic culture that exists. It's helping nobody. So
Nobody.
reject the toxins, everybody. Reject the toxins. And